Hi, I'm Dr. Falbo from Red Apple. And what I'd like to do today in a very short segment is give you a 3-minute screening test that any teacher, any school nurse, any doctor, any parent could do on their own child. It's 3 minutes, 3 questions, and 3 tests that you can do. The 3 questions are very simple. Number 1, does he or she skip or add words as they read? Number 2, as they read, do they frequently lose their place? And number 3, after they've read a passage, do they have difficulty remembering what they just read? So number 1, do they skip or add words as they read? Number 2, as they read, do they frequently lose their place? And number 3, is it difficult for them to remember and use what they just read? Now let me demonstrate the 3 tests for you. So now that we've asked 3 questions, we're going to do 3 games or 3 tests to determine whether this student may have a visual perceptual issue and then could possibly benefit from vision therapy. We're going to use an interesting fixation target like this little zebra. This is called the pursuit test, and we're going to mark whether her eyes follow it in a smooth or a choppy fashion. We want it to be smooth. So if you can look right at his nose, hold your head still, and follow it with your eyes wherever he goes. Back and forth, don't let him get away, back and forth. You're doing great. Now we're going to go in a circle. Keep following him. Keep following him. You did great. Give me 5. So in this game, she did very, very well. We would mark smooth. If perhaps it was choppy or a hop, skip, and a jump type motion, then that would be a reason for referral. The second game we're going to play is convergence to near point. Convergence to near point is quite simple, and when we take that same target, we're going to bring it all the way in towards her nose and see if she can converge and stay on it all the way in. Take a look right at his nose, and now follow it all the way in. Don't let him get away. Tell me if you ever see 2, but try to keep it 1. Excellent. We're going to do it 2 more times. Keep looking right at his nose. Keep looking. Keep him 1, but tell me if you ever see 2. Great. And 1 more time. Can you handle it? Can you do this? Good job. Give me 5 again. On all 3 of these occasions, she converged all the way in towards her nose. What you would record is at what distance did she break down. So if she told you that she saw 2, or if you saw an eye deviate outwards, then you would mark that down 3 inches, 6 inches, however far it was from her nose. The last game or test we're going to play is called the cover test. On this game, I'm going to use my hand to cover one eye at a time. As a teacher, you're going to look at the back of your hand while she fixates on his nose. And when you remove your hand from one eye and move it to the other eye, the eye that you uncovered, you're going to look at to see if there's any movement. We would like there to be no movement. So if you can look right at his nose, and I'm going to cover one eye, and I'm going to move my hand, and I'm going to look at the eye that was behind your hand. And in this case, there's really little to no movement. Excellent job. Give me 5 there too. Now she did really well on all 3 of these games. If any one of these games, or if any one of the questions had yielded you a positive response or a possible problem, then that would be enough for a reason for referral. If you have any other questions, don't ever hesitate to call. Now, if you like that video with the #1 secret to uncovering vision therapy problems, then I have 5 more that I'll give you, 5 more secrets on how you can help your child in school and at home overcome and adapt to these issues and start to do much better academically. The video's on a DVD, it's free. I'll be glad to send it to you, and I'm also going to add a couple vision therapy techniques that you can do at home just to get you started on a home vision therapy program. The DVD is free. All I ask is that you pay shipping and handling. To get your free video, simply email me your name, your address, and a phone number where we can reach you. We will get back in touch with you, send your free video straight out, and all you will have to do is cover the shipping.